Hi, my name is Kayla Tabor. I am 25 years old and have been a registered nurse since January of 2017. I graduated from Ashland University in December of 2016 with my BSN. About a month later, I started working as a nurse at Mount Carmel West on an inpatient unit. And then a few months after that, I transferred to Nationwide Children's, where I've been working in their allergy and immunology clinic for the past almost 3 years in April. I am very interested in Mount Carmel's Family Nurse Practitioner program for many reasons. One being that I always knew, even when I was graduating from nursing school, that I would further my education. I just wasn't sure which route I wanted to go. I had thought I was going to end up doing education, like becoming a teacher, because wanted to be a teacher when I was younger. I didn't know if I wanted to do the administration part or the nurse practitioner route. And my current job now is what I think really has pushed me to do this, because in the past couple years, I've really noticed a big interest or spark of interest in myself of learning the specifics of why certain labs are ordered by the providers, why certain medications are prescribed. I mean, I'm constantly asking the providers I work with, like, what's that lab mean, or why did you choose this for that? Did that medication work for that patient? And I think that's a really big part of being a nurse practitioner is having the appreciation for developing the rapport with patients, that is one of my favorite parts of what I do right now. We have kids that come in for allergy shots monthly and weekly and monthly, and then kids who come in every like 3 to 6 months because of asthma. And one of my favorite parts of what I do now is seeing a family come in for the first time. They cannot figure out why their child is ending up in the ER for asthma every month, and then the provider puts them on an inhaler like Flovent, and then they come back in 6 months and they are doing great, and the family's life is just completely changed. And then in a year they're still without going to the ER, and it's the best feeling, and it's not even coming from me right now. And then, so like I said, developing the rapport and then being able to give patients the care that you would want for your own family is something that I know I would be able to do. Just treating patients. And right now, like, I love being able to, and I've learned communication skills of not only being able to communicate with kids, which is challenging in itself, learning how to explain things for them to understand, but adults as well. So that's a huge part of it is communication, confidence as well, which I have definitely grown a lot since becoming a nurse. That's something I kind of lacked, but that's completely opposite now. Completely gained the confidence of knowing and learning and being able to walk into a room, and right now just even as a regular nurse, just giving patients the greatest care. You're 100%. Even if you're having a bad day, you walk into the room and give them a happy face, and you're all. And I just think that I know I would be a great nurse practitioner. I know I can do this. My current job is great right now at allowing me to do the 2 class per semester route. I will be working full time, and then when the time comes to have to drop a day, like Wednesdays, I think it is, I know I'll be able to do that as well. And my overall goal would to be a pediatric nurse practitioner in the outpatient setting. And I think that's all. And I hope to see you soon. And thank you for your time. Bye.